Madam Rafi. Today we are going to discuss about introduction about ANS. First we will see the classification. In the classification, first it divides into three parts: parasympathetic nervous system, also known as cholinergic nervous system; sympathetic nervous system, also known as adrenergic nervous system; and enteric nervous system. First we will see the parasympathetic innervations. It is also known as craniosacral outflow. In the cranial nerves, in the cranial part, what are the nerves will have? Mainly 3, 7, 9, 10 cranial nerves. First, ciliary nerve, it will have supply to the ciliary muscle of eye and circular muscle of iris. Facial nerve will have supply to the salivary gland, lacrimal gland. Glossopharyngeal nerve will have supply to the parotid gland, nasopharynx. Vagus nerve has supplies to the heart, lung, GIT. Okay. So here the main neurotransmitter is acetylcholine. That's why we call it as a cholinergic nervous system. Next, coming to the sympathetic nervous system. In sympathetic nervous system, it is a thoracolumbar outflow. Here the innervations from the nerve innervation mainly from cervical ganglia, that is C1 to 7, celiac ganglia T5 to T11, superior mesenteric ganglia, that is T12 to L1, and inferior mesenteric ganglia. So the innervation from cervical ganglia is it supplies to radial eye, mainly eye area. Then celiac ganglia, gastric, liver, spleen part. Then superior mesenteric ganglia, it supplies colon, rectum, kidney. Inferior will be distal colon, rectum, bladder, and genitalia part. Here the main neurotransmitter is norepinephrine mainly, but here the NCQ will be focused on what are the exceptions. Here we have exceptions. What are the exceptions? We have acetylcholine has also act as a neurotransmitter in some nerve parts. Samely, dopamine also acts. Okay, is the main NCQ focus is what are those exceptions? First exception is preganglionic sympathetic nerve supplies to the chromatin cells of adrenal medulla. Here mainly you have to remember preganglionic. It should be preganglionic, and that nerve supply should be chromatin cells of adrenal medulla. Second is postganglionic sympathetic fibers of sweat gland. Next one is third one, postganglionic sympathetic fibers that supplies the arterioles of skeletal muscle. Okay, so these exceptions has to be remembered. Main neurotransmitter is norepinephrine, but there will be exception. That is, acetylcholine will supplies preganglionic nerve supplies to the adrenal medulla. Next, postganglionic to the sweat gland. At the same time, postganglionic to the smooth skeletal muscle arteries. Okay. Next, dopamine also there. This dopamine mainly supplies to the renal blood vessels only. Okay. So this is the main exception. This is the most frequently asked MCQ. You have to be remember. Next, coming to the enteric nervous system. Enteric nervous system is also known as brain of gut. Here the innervation will have two, parasympathetic, at the same time sympathetic innervation also there. The main actions will be intestinal motility, exocrine and endocrine secretions, microcirculations of gastrointestinal tract. So here the MCQ focus is what is the brain of gut. It is maybe sympathetic nervous system. They will give options like sympathetic, parasympathetic, enteric. Brain of gut is enteric nervous system.